It's to France now. That country has set another record for daily COVID-19 cases with more than 16,000 new confirmed infections over the last 24 hours. And the number of people hospitalized, well, that has risen as well. To contain the virus, France has introduced stricter rules in major cities, including Marseille. We'll talk with corona researcher John Campbell about a possible second wave after this from Marseille.
Residents in Marseille enjoying what could be the last drink at their local cafe for a while. From Saturday, bars and restaurants in France's second largest city will be forced to close for at least 15 days as the new coronavirus measures come into place. Owners and employees are in dismay. This restaurant manager says he has already lost 200,000 euros since the beginning of the year. We've taken out loans, and it's not just us, it's the restaurants, the shopkeepers, they all got loans. We have to pay them back in less than 6 months or we will have to close down. It's scary. Marseille is on maximum alert due to a surge in COVID-19 cases, but many bar and restaurant workers feel they are being unfairly targeted. We are unjustly punished, stigmatized. Fingers are automatically being pointed at us, bars and restaurants. We're responsible for the rising COVID cases in Marseille. It's nonsense. How and why are we responsible for this when we do everything to comply with the rules? If people don't party or don't go out to bars, they will do it at home. I don't really see the difference between a bar and someone's home. Around the country, other cities are also bracing for tougher restrictions. In the capital, Paris, bars and restaurants will have to shut at 10 p.m. French health authorities have defended the new measures, saying they are the only way to prevent hospitals from becoming overburdened.
We're joined now by John Campbell, one of YouTube's more famous coronavirus researchers and analysts. Many of us have been following him since the pandemic began. Thanks so much for coming in, John. Is the spike we're seeing in Marseille and other European big cities, is it a regional phenomenon or is this Europe-wide?
It's pretty well Europe-wide. I mean, at the moment, Spain is leading the increase in cases, then France, and then the UK is increasing quite a bit now. But there are notable exceptions like Italy. So it is a bit patchy, but there was a summary by Washington State University in Seattle just a couple of days ago, and they described Europe as surging generally. So we're seeing a general trend in Europe of increases, but we are seeing particular countries increasing at a more rapid rate. And of course, what we need to do is learn from the mistakes of the countries that are increasing at a more rapid rate and try and use that information to keep the levels of spread down in other countries, such as Germany and the UK, where the levels are currently lower.
A lot of people are talking about a second wave being a possibility. We need to define our terms, of course. Is this a second wave, the start of one?
It really depends on how you define it. I mean, what really matters is the pragmatic definition. And in a second wave or an increase in cases, the point is we have a sustained increase in cases from day to day, from week to week. And that is exactly what we're seeing in parts of Europe. And we're seeing it at different levels as well. So as we've said, Spain and France at higher levels, UK and Germany still increasing, albeit at lower levels. I probably would call it a second wave personally, because there are obviously quite high numbers of cases back in March, April, May. Then we went down in the summer. There's a lot of reasons for that. And now we're going back up again. But I really think it's important to learn some of the lessons from these other countries that are doing well and the countries that aren't doing so well at the moment.
Okay, what would be some of those lessons, if you would, John?
Well, Italy did very well. Italy's app is working very well. We only had started with the app yesterday in the UK, which is really quite a sad situation that it's taken so well. And Italy wasn't complacent over the summer because Italy suffered so badly in the first wave, and it was the first country really to suffer, that I don't think it had forgotten the lessons of what we might call this first wave. Whereas other countries took their foot off the accelerator a little bit. Italy maintained its 14 days quarantine. It didn't really encourage tourism the way Spain did. A lot of the resurgence in cases in Spain now are from tourism. So it was minimal. And Italy used its testing capacity wisely. So all countries have limited testing capacity. But Italy targeted to test trace and isolate the contacts of people that were symptomatic, the contacts of people that were asymptomatic, whether it's work, family, or social. And the other thing they did in Italy was they identified specific infection drivers, and one of those was dancing in nightclubs. So that was banned on the 17th of August.
That's the aerosols that are probably responsible there. But we have time for one more question. Yes. What about the mutation some people have been saying? Is how dangerous is that? What's happening with the mutation?
There's an ongoing debate about this, and this virus mutates all the time. We know it mutates all the time. But the consensus of scientific opinion in the UK at the moment is that although the virus is mutating, and although this is useful for what we call phylogenetic analysis, we can work out where a particular viral strain came from by tracing back the mutations. The consensus of opinion is, at the moment, this is not dramatically increasing or reducing how transmissible the virus is, or the pathogenicity of the virus, how likely the virus is to cause severe disease. But that's always a possibility. It could happen. And some people think it has already, but the consensus opinion.
For now, John, we'll take that as good news. Okay. John Campbell.
Good news on that so far.
That's right. John Campbell, thanks so much for coming in, and keep up your work there for all of us. Thanks very much.
Pleasure, Brian.
Let's get you a roundup now of some of the other developments in the pandemic. Israel has toughened its coronavirus measures after a second lockdown failed to reduce new infections. The new rules will close most workplaces, shutter markets, and further limit prayers and demonstrations. Britain has reported its highest number of new cases in a day, just over 6,600. The government announcing sweeping new measures earlier in the week designed to curb the spread of the virus. And the number of people who have died from COVID in Mexico has now passed 75,000. That country has seen more than 715,000 infections. And Rio de Janeiro has delayed next year's world-famous Carnival celebrations. The event, which draws millions of visitors, was to take place in February, but has been postponed indefinitely due to the pandemic. Brazil's grappling with the world's second deadliest outbreak.